What if you could sit down once a week with a colleague who's a flat-out warrior? This colleague wasn't a stud in dental school. He struggled. He returned to practice in his hometown, an area once labeled by USA Today as the second worst place to live economically in the United States. And this very same colleague went on to establish an historically successful general practice known worldwide. What if you knew someone that wanted to take you by the hand and show you everything you need to know, from treatment planning to leadership, to maximizing your journey in dentistry, or just life? You ready to be inspired? Welcome to the Lionhearted. Hi, everybody. Welcome, Lionhearts. I've never said that before, by the way. I've never said welcome, Lionhearts, as if I'm describing my listeners as lion-hearted dentist. Okay, listen, I'm going to make this one quick this week, and I think this is a little higher up level of your journey if you've opened a practice, or even if you're an associate, but it is a way for you and a protocol for you that you must incorporate if you really want to know where you're at in your progression from an average dental practice or dentist to an elite dentist. And I'll start you with a quote. And I heard this quote on TV and I liked it, so I remembered it and I Googled it. It says basically that if you can't measure it, you cannot improve it. You can't fix what you don't measure. And that was written by one of the most famous management authors of the last 20, 30 years, a guy named Peter Drucker. So think about it for a minute. Here I am telling you how hard this ride is that we are all in together. You know, the journey to reach an elite dental practice established in your community. I mean, that's my goal for you. To be the go-to office, whether you're in Europe, India, South America, or the United States or Canada. I'm trying to get you to incorporate protocols that will make you the place to go, like other businesses have achieved in your community. Whether it's the best restaurant, whether it's the best veterinarian, that's what I'm trying to get you to do. And now, I've told you this in a myriad of ways, but now I'm going to tell you, well, how do you know? How do you know if you're reaching and progressing, reaching lofty levels and progressing? And the answer is you have to start measuring things. And this is very, very hard to do. In fact, doctor, you're not going to be the one to do it except for your surgical outcomes. If you're involved, it doesn't have to be surgical outcomes. I have to implore you today as a clinician, because you've heard me always say, like it or not, that clinical excellence will take you further than any practice management gem that I or anybody else could ever give you. So you can have the most beautiful reception area with a waterfall and granite from one end of the room to the other, and yummy goodies like I have in my office with a refrigerator. They just don't have water there. They got a selection of drinks and all kinds of snacks. But that means nothing if your real level as a clinician is closer to average and mediocre versus elite. So one of the things I tell my doctors that come to my courses, and I'm telling you that you should do, is you need to highly document photographically all your cases. And I've never really spoken to you about that, but you need to get yourself a really good camera. And there's a million places today to do that. I have a Canon. I don't even know the number of it. They're pretty easy to use. The hard part is you really have to be diligent in using it. Every anterior case we do, I don't care if it's a single lateral incisor, which I did on Thursday, and I sat down. By the way, teams listening today, have your doctor ready to go. I'm in my private office in between patients sometimes, and the MO of one of my assistants will be to park herself outside my door, and I know that means they need something in the back. And commonly, that assistant will say, "We're ready for you in room 2." And I'll say, "What is that case?" And the assistant may say, "It's number 7 crown." Okay? This ever happened to you, doctor? This is called the ready to work protocol, and it's for your team. Now, I may be in the middle. Trust me, I don't have time for nonsense when I'm at work. So I'm not in my room looking at the ticker tape on Wall Street or anything like that. I am usually calling I'm referring to a doctor for something, or trying to get a clearance on a patient, or whatever it is. So when I get interrupted and I leave my room, I want to be ready to go what they called me for. And I will sit down often and I'll look, and it's an anterior case like this case I just discussed, and I'll say, and I shouldn't have to say this, and neither should you. Did you get a photograph? We've been taking photographs on our interior work for 25 years. Really? You want me to have to remind you of that? This was of an old, ugly crown that somebody had placed. Metal margin showing, opacity. I probably don't have to improve it much for it to be a wild improvement to this patient. But let's just say, for whatever reason, because I practiced 42 years, this patient says, "I don't really love it at the end." I certainly want to remind them where we started. You ever have that happen to you, doc? You need photographs on everything you do. Let me tell you what else you need. If you have taken this road that I've encouraged you to take on surgical dentistry, there is an endless list of suggestions in the marketing world of what you should use for membranes, for your socket seal, for what bone graft to use. Perhaps you want to try out Gem 21, which helps grow bone in missing wall sockets. Maybe you've checked out Osix Plus, things like this, resorbable membranes. Maybe you wanted to try the mixture of 70% mineralized allograft with 30% demineralized. Okay? I could go on and on. You need to be vigilant in starting a folder in your computer, a list of patients of what you used and how does it look 16 weeks later, clinically and radiographically. You know, you've heard me promote Stella Life. Stella Life is a company that manufactures plant-based medicaments to help our patients heal better. And it clearly works. But you haven't used it. And I don't know what it costs per package for my patients. I don't make a dime off it, by the way. So when I'm doing a multiple extraction case or a multiple implant case, my dental assistant is trained to ask me, because if she doesn't ask me, which took some time to instill, you see how everything is a protocol. Everything has a description that goes with it. Because if you don't do that, you're going to have inconsistent approaches and inconsistent outcomes, or you'll eat a lot of things. Meaning, I need my dental assistant to prompt me on that, because I may not be thinking of that at that minute that I'm pulling 8 teeth on this patient. Doctor, do you want Stella Life? Well, it costs, I don't know what it costs. I think $85. Yes, I want Stella on this case. Do you want Denamedica? Denamedica is a vitamin boost of 6 weeks we give certain patients that ensures they have adequate rates of vitamin D in their bloodstream, in their body, that promotes bone growth and bone healing and soft tissue healing. So we need adequate amounts of that. And a lot of people in North America are deficient of that due to our diets and lack of adequate time outside, quite honestly. Processed foods was the word I was escaping me. So do I want Denamedica? Do I want a PRF draw? See, again, you can see how I need to be prompted. And if I really need it and I didn't ask for it, guess what? I'm eating it. So you kind of get where I'm going. But you don't know for sure that these things are worth it to you. And I'm sure I'm the tip of the iceberg in the other courses that you take. Maybe you will try a different approach with your Invisalign or with your endodontics and other arenas of clinical dentistry. You need to measure yourself. And the way you measure clinical dentistry, in my opinion, is with excellent photography of your before and your afters, because that doesn't lie to you. Okay? Maybe you're trying a new lab. Same thing. This all goes with a genuine Lionhearted dental practice. It's kind of up there on the scale, Rogers scale of survival. Those of you that are familiar with psychology, you know, in the beginning, we're just trying to get the basics of a good practice together. And as we escalate towards higher levels of practice, you have to start measuring things. So now let me talk to you about measuring your practice metrics. So I've gone on this podcast many times and I've said to you, never in my career did I have quotas of our goal for this month is $100,000. I've never done that. And you want the truth? I don't even know if that's a good approach. What I know is that if you do a quality exam, the way I've discussed in over 5 podcasts when I started this in 2018, it's right there for the taking if you go back and you look at them. If you go back and look at how I do an exam and what I'm trying to cover, it's the 5 principles are right there. So the question I have for you is, do you know things like the number of people that visited your website last month? Do you know that? Because we're at a higher level in this discussion this week. And it's something you need to know whether you're achieving a nice new patient per month outcome or not. So that is different to me even than having quotas, which I've already told you, I'm not sure my approach is the best approach. I just know, but as long as I've been doing comprehensive exams, I've never really had to worry that much about high case acceptance. And I never found myself doing one-tooth dentistry for here and there, we do one-tooth dentistry. Sometimes a patient on a recall needs one single crown. Okay. Often, new patients need significantly more than one-tooth dentistry. Okay. Do you know how many of the people that visit your website turn into new patients? Maybe you're not as busy as you think you should be. Maybe that's the answer right there. And, I don't want to get into marketing discussion today, but marketing is different whether you live in New York City or any other major metropolitan area. I can market differently than you because I can afford to in a rural area. I can afford to be in the newspaper. The return on investment is very doable. I can afford to be on the radio even. You can't advertise on WABC rock station in New York City and make it, unless you're a gigantic conglomerate of offices. So we're just keeping it real here today when we talk about this. But all of us, need to have an attractive website that is working for you. And so understand that. If you're struggling, these are the metrics you need. And if you don't know that, you need to reach out to me and I can get you somebody that can help you. I have somebody that will help you find those answers. So do you even know how many new quality new patients? So the first question is how many people that visit your website turn into a phone call for an appointment? But they don't all come from your website. So the next question is really, do you know how many new patients you get per month? And when I say that to you, a lot of you say to me, I get 100 new patients per month or some obscene number. I don't get that. I don't get that because I qualify as quality new patients. I don't consider somebody coming in, taking a PA of one tooth, which I would never do, remove that tooth as an emergency, as a new patient visit, even though it is. My new patients are screened, different podcasts, different information. They're screened because I have found that to be way more worthwhile in my career than servicing emergency patients. What you're taught by many is you bring everybody in. You get them to love you, and then they'll make it a new appointment and come back, said nobody ever in real life that practices dentistry. What happens is they come back, they do, if they like you, when they have their next emergency. And that's not a good way to run a practice, and it's not a good optimal way to achieve high levels of oral health for any patient. Remember what L.D. Pankey said, part of your responsibility as a dentist is as an educator, educating your patients. Okay, so do you track? So you got to do all these things. And remember what I said, again, my email, drrasner@aol.com. Okay? I can steer you to people that will help you with this. Because if you really want to get high up there, higher than you are right now, then you need to know these things. What about your average case? I can tell you that our average case, in terms of how much it is absolutely significant. Why would that be? Because I really do comprehensive examinations, which I've implored my Lionhearted dentist to do as well. That's not just a sentence you hear on a podcast. It's really how I live. I love doing them, by the way. After 42 years, I love doing them. And there's a whole magic to that you would benefit when I do a live course in, not this year, but 2024. So, yeah, like if you're telling me your average case is, $2,000 or $2,500, that absolutely tells me you don't do comprehensive care exams, or you don't really do them diligently. You might start that way, but something persuades you to bail, and you end up treating them driven by their insurance. That's not comprehensive examinations. What about this? Do you have any protocols in place to evaluate the patient satisfaction of their completed work? So let me just say that again. So for years and years, and now we've recently, I've come out of hibernation that I've been in for, not just since my surgery, but I think I've been in hibernation for a couple years because everything was on automatic pilot, because that happens sometimes. You're doing so well that you probably don't even listen to my podcast anymore. And I'm happy for you. But eventually, it's going to turn south, and you might be dropping back today for the first time in 18 months. And I'm here to tell you part of what happened to you is you're not monitoring the satisfaction. How do you know? How do you know if your patient's truly happy with, listen, they might have spent 10, 15, 25. If you're doing all on cases, obviously they spent way more than that. Don't you want to know how you're doing? I had a lady I did 5, 6 years ago. It was a completely slam dunk case. A Crown and Bridge case of 12 units, 2 visits. By the way, I'm sorry, I didn't say this earlier. Any case like that, you must begin the case with full photograph documentation and models and a bite. Always just make that a protocol. Alginate impressions or scan them, scan the bite, and have that in your office as a guide to where you started. Please listen to me and do that. Okay. So what we did for quite a long time, we still do the following. And this is not a real survey. We would follow them up the day after a case, the week after a case. We automatically, on large cases, not a 3-unit bridge, not a single implant crown, not even 2 implant crowns. I don't know, I can't define it. It's different for everyone. But a significant case in my eyes, we have them back automatically in 2 weeks to just reevaluate the occlusion, their happiness. By the way, we also do that with a large provisional case. So let's say you prepped 14 teeth. Do you go right to a finish? Or do you bring them in 7, 10 days to make sure that everything is satisfactory in the provisionals of that patient? You know what you should do. This is hard work, man. But that's the reason why when you've earned it, when you've taken enough CE, you need to get paid to cover these visits because you're not charging for that 10 or 14 day, hey, how did we do with the provisionals? Are you happy? Now, they may answer you on the phone, and I would see them unless they ask, do they have to come in because they're perfectly happy. Have I ever had that happen? Yes. But I would not encourage that to become a habit because when they're right there in your chair, they'll almost always tell you more. We, for years, did the thing called the exit interview. And the exit interview was done not the day we put the case in. For goodness sakes, the patient's still numb that day often. They might even be sedated in my office or lightly sedated. No, this would be the post-op 14 to 30 day check. And that's when they would get an exit interview. It would be on our daily morning meeting to be done. And that patient would be brought in to a private office and we would ask probably softball questions, but questions like, how did you make out? The purpose of us asking you these questions is to make sure we can serve you better in the future and our other patients. So is there anything we could have done better? Even the very fact that you are willing to do that, you are willing to even ask that, perpetuates you to be better. It incentivizes the entire office knowing that you're going to have this interview. It may be day 1 with this patient when they all love you and they accepted treatment and wrote you a check and signed on the dotted line and everybody's happy. How happy are they 4 months later, 6 months later, whatever it is? I can tell you in a surgical case, it can be daunting. It can be daunting because everybody has selective amnesia on when the case is going to get done, no matter how careful you are in documenting that. So, which brings up another one. We even have systems for those exact cases that I just mentioned, the ones that involve implants that can take 6 to 8 months. We have systems in place to monitor the progress of that case. I've had patients fall out of treatment for a year. Had it just happen to me. She had implants placed on 5 and 12, never restored. because the next step was prepping 6 through 11 to go with 5 and 12 to restore her smile zone. Very common in my world. And tragically, she lost her son, got very depressed. I completely forgot that this case even existed. I didn't even remember the case. And that, by the way, for the 10th time of telling you, showed up in my morning meetings. The best relaunch of any protocol I've done in 10 years. Having a quality morning meeting every day has completely reduced my stress and improved the quality of my office. And if you have questions on any of these things, and don't ask me, shame on you. I'll give it to you. I guess this could be part of a mastermind group type of talk as well. It's hard to do this each week. I come on here and try to outline for you weekly what to do to maximize your career. That's what we're doing right now. And today, we're talking at a really high level. So do you have any exit interview protocols in place in your office? You need to. Watch the next time you buy a car. Watch the next time you go to a hospital or buy a product of significance. You will be hit with a litany of emails that are annoying to some degree, but also very necessary because they are measuring how they are doing, and you need to do the same thing. You do. I'm going to leave it at that. Keep this one for real at 26 minutes. I think this is a good one. I hope you guys enjoyed it. Tell your friends about my podcast. I'm not getting as many downloads in the last month or two, and I don't know. I think they're missing out. Have a great week. DrRasner at AOL.com. I know, it's a joke. Write to me. I'd love to hear from you. See you next week on the Lionhearted.